Hey everyone, welcome to Imaging Study. Today we are going to see a case of focal pancreatitis. A 13-year-old boy came with severe upper abdominal pain. We have got the biochemical findings of this patient and the serum amylase and lipase were high. Let's see what we have got on ultrasound. Here you can see the epigastric region. You can see irregular hypoechoic area at the pancreatic head region mimicking the mass. This is the main pancreatic duct which is dilated. If you look at the gallbladder, you can see hyperechogenic thick area casting postoacoustic shadow which might be thick sludge or calculi as the patient was in NPO state with broad spectrum antibiotic. There are foci of calcification at the head region indicating it as a case of recurrent pancreatitis or acute on chronic pancreatitis. Now this hypoechoic area is making the confusion with mass or focal acute pancreatitis. As the serum amylase was high and the patient had a short history, also the age was around 13, we would love to stuck with focal acute pancreatitis in this patient. Here's the magnified view and you can see the mass-like area involving the head region indicating the focal inflammatory change of the pancreatic head. You can see the MPT dilated. And this is the echogenic sludge or calculi, and you can see at the head region tiny hyperechogenic areas indicating the parenchymal calcification. Here's the picture and you can see the main pancreatic duct is around 6.5 mm and you can see some tiny hyperechogenic foci at the pancreatic head region indicating parenchymal calcification, and adjacent to it the pancreatic head looks enlarged, lobulated and irregularly hypoechoic mimicking the mass lesion. Here is the hypoechoic mass-like pancreatic head region. You can see some surrounding hyperechogenic thick area indicating the fat stranding. This patient came to us for a CT correlation, and here you can see the main pancreatic duct is dilated. Gallbladder shows hyperdense structures indicating thick sludge or calculi. Here you can see the head region shows a hypodensity. You can see the hyperdense area at the pancreatic head region on non-contrast image indicating the parenchymal calcification. On contrast, you can see this hypodensity quite clear. This hypodense area at the pancreatic head region is of focal pancreatitis. Here is the coronal cut and you can see some adjacent fat stranding. This is the non-contrast image and you can see the hyperdense area within the gallbladder lumen. This is the dilated main pancreatic duct. Here is another picture and this is the pancreatic head region mimicking the mass. So in summary, echogenic thick sludge or calculi noted within the gallbladder lumen. Irregular focal hypoechoic enlargement of the pancreatic head mimicking the mass lesion is noted with surrounding fat stranding, parenchymal echogenic calcifications and dilated main pancreatic duct. So this feature suggests it as a case of focal acute pancreatitis. Now the take-home message. Correlation with the duration of symptoms and biochemical findings may help differentiate between the pancreatic mass and the focal pancreatitis, especially when the patient comes with obstructive features. Thank you for watching this video. Subscribe to our YouTube channel for more. See you on the next one. Have a nice day.